Good evening, everybody, and welcome to our July webinar by Dr. Roxanne Becker on diet and diabetes reversal. This is a definitely very exciting webinar to be a part of, as I think we'll want to learn more about how to not just help our patients like treat their diabetes, but also reverse it. So Dr. Roxanne Becker is a medical doctor who graduated from UCT with her MBBCH cum laude in 2018. She went on to gain her diploma in lifestyle medicine, as well as extra accreditation and certification in plant-based nutrition from the University of Winchester in 2022. She's extremely passionate about plant-based nutrition and the good it can do to this world, as well as how to use it in a medical sense. She's currently the vice president and treasurer of SALMA, but more than that, she is working for the Physicians Committee for Responsible Medicine in their role and research on plant-based nutrition and disease processes. So thank you all for joining us. Just before we start, I'm going to ask that you all please make use of the chat and post any questions. The presentation is not the full hour, so there will be time to answer those questions as we go through it. And as always, if you want to reach out to us, we'll also leave contact details and our website in the chat below.
Perfect. Thank you so much for that introduction, Yakira. I am just going to share my screen quickly. Perfect. If you can't see that, then please just let us know in the chat. Okay, perfect. So we are ready to get started. So today's topic is diet for diabetes remission, and this is a topic that is very close to my heart. Here has basically gone over my introduction for me, so thank you so much for that. As she mentioned, I graduated from UCT. I've done my diploma in lifestyle medicine, as well as additional certification in plant-based nutrition. I'm currently working for the Physicians Committee for Responsible Medicine in Washington, DC, and there some of my main responsibilities include clinical research and education. And I've been following a plant-based diet for almost 10 years now, and the disease that I'm most excited to research and that I'm involved in researching is diabetes. So I absolutely jumped at the chance to speak to you all today about it. So today we are going to be covering the diagnostic criteria for diabetes and therefore for remission as well, how we can prevent diabetes through diet and lifestyle, the pathophysiology of diabetes and what the underlying cause is, as well as dietary approaches for diabetes remission, including plant-based diets, low-carb diets, and low-calorie diets, as well as some practical considerations for deprescribing diabetes medication. Because during medical school, we all learn how to prescribe insulin and metformin, but we're not really taught how to deprescribe it because it's not something that has commonly been done up until now. So why is diabetes a problem? Why are we devoting an entire hour-long webinar to this? Well, 2 in 3 obese adults have type 2 diabetes around the world. We know that obesity is one of the leading risk factors for type 2 diabetes. And currently in South Africa, diabetes is our second leading cause of death. And so whether you're working in public healthcare or private healthcare, you are bound to run into diabetes at some point. A recent survey from 2022, so just last year, screened over 6,000 individuals and found that 67% of South Africans are pre-diabetic, with many of them going undiagnosed. Now, obviously, this is not necessarily a representation of the entire population, but pre-diabetes should be a huge red flag. Like if you're dating someone and they say they're not ready for a relationship, then that should be a huge red flag that you shouldn't continue in your habits, hoping that one day they'll change. And just the same, if someone has pre-diabetes, it is a big red flag that they cannot continue in their habits if they don't want to end up having diabetes. But unlike a person, diabetes has no commitment issues. So pre-diabetes is really the big red warning flag that we need to intervene as early as possible. And diabetes is on the rise. It has almost tripled from 4.5% in 2010 to 12.7% in 2019. So it doesn't matter if you are in the maternity wards, the surgical wards, the medical wards, you are going to encounter diabetes wherever you go. So these are the diagnostic criteria for diabetes according to the American Diabetes Association. And in order to be diagnosed with diabetes, you just need to fulfill one of these criteria. And that includes fasting glucose, an oral glucose tolerance test, an HbA1c, or a random plasma glucose with symptoms of hypoglycemia. And so therefore it makes sense that if we're talking about diabetes remission or reversing diabetes, that you shouldn't fulfill any of these criteria if you want to be diagnosed as not having diabetes anymore, because just having one of them means that you do. So first, we're going to look at preventing diabetes through diet and exercise. So let's first look at the role of nutrition in preventing type 2 diabetes. The Adventist Health Study 2 was a massive prospective cohort study of over 61,000 people. And it found that as you move from a non-vegetarian diet or an omnivorous diet to a semi-vegetarian diet, which is eating meat once a week, to a pesco-vegetarian diet, including fish, to vegetarian to vegan, there's almost a stepwise reduction in the incidence of type 2 diabetes. If we look at the 17-year Adventist mortality study, as well as the Adventist Health Study 1, we see that weekly meat intake was associated with a 74% increase in the odds of developing diabetes, and that's just consuming meat once per week. If we look at Taiwanese Buddhists, vegetarian men had approximately half the rate of diabetes, and vegetarian postmenopausal women had around 1/4 of the rate. And there are similar trends amongst Chinese and Singaporean communities, amongst Australian communities. And so it really is around the globe, we see that as people consume more plant-based foods and more whole foods and reduce the amount of processed foods and animal products in their diet, they reduce their risk of developing type 2 diabetes. If we move on and look at the role of exercise, the Diabetes Prevention Program Research Group conducted a study, and they looked at over 3,000 people with pre-diabetes. And they were randomized into 3 groups. Either they took a placebo every day, or they took metformin twice a day, or they were enrolled in this lifestyle intervention program. And the lifestyle group were educated on a generally healthy diet, to minimize processed foods and to eat more whole foods, as well as encouraged to get around 150 minutes of moderate intensity exercise each week, such as brisk walking. And at the end of 4 years, we can see that the lifestyle group had a greater reduction in weight, and obviously they increased their physical activity more as well. And at the end of 4 years, we can see that the lifestyle group had a lower chance of progressing from pre-diabetes onto diabetes, followed by the metformin group and then the placebo group. And if we compare the lifestyle and the metformin group, the lifestyle intervention resulted in a 39% lower risk of having diabetes at the end of 4 years compared to the metformin group. So you might be wondering, what is then the best type of exercise for diabetes? If we are counseling our patients and they ask us, so what should I be doing? Then we should have an answer for them. And that is exactly what the HARD-D trial looked at. So they took 267 sedentary people who were randomized either into a control group or into one of 3 training groups. And these involved either resistance training, so body weight or weight training, to aerobic training, which included brisk walking or jogging, or a combination of both. And at the end of 9 months, those who had the combination of resistance training and aerobic training had the greatest reductions in A1C, followed by the aerobic group and then the resistance group. And if we look at the changes in their body composition, we can see that the aerobic group lost the most body mass compared to the control and the resistance groups, but the resistance group lost more fat mass. So they didn't lose as much total body weight, but they lost more fat mass. And the reason for this is because at the same time, they increased their lean muscle mass, or the amount of muscle that they had. But at the end, we can see that the combination group resulted in the greatest reductions in both body mass and in fat mass. So how does this happen? How does exercise improve insulin sensitivity? I'm sure we've often heard people saying that we should counsel our patients to go for a walk after they have a meal to improve their glucose uptake. And really it comes down to how exercise increases GLUT4 expression. So GLUT4, I know we have some medical students joining us, which is fantastic. So GLUT4 is the glucose channel, or the glucose port that is inserted into cell membranes so that glucose can move from our blood into our cells. And just an acute bout of exercise increased GLUT4 expression by 22%. And if you look at the graph, we can see the insulin-dependent glucose uptake. GLUT4 expression was at the highest, and glucose uptake was at the highest a few hours after exercise. And this effect lasted for up to 48 hours after the initial bout of exercise. And so with our patients with diabetes, we really want them to be exercising at least once every 2 days. So let's look at the pathophysiology of type 2 diabetes. We're going to start by looking at muscle cells and liver cells. And if you've been through med school, I'm sure you've heard the analogy of the lock and key. So let's just briefly go over it. So normally our muscle and liver cells are impermeable to glucose. That means we need insulin. So when we eat a meal and the carbohydrates are broken down into glucose in our blood, it stimulates our beta cells to release insulin. And insulin comes along like a key and it unlocks the cell. And after insulin has bound to its receptor, there is a whole cascade of intracellular reactions that occurs that allows the glucose ports to be inserted into the membrane. And this means that the glucose can be taken up by our cells. But what happens when you eat a diet high in saturated fat? You're having bacon and eggs for breakfast, a burger for lunch, steak for dinner. Well, then we see that we get this accumulation of intracellular fat. So these fatty acids are taken up by our muscle and our liver cells. And what that does is that it essentially acts as chewing gum in a lock, and it prevents this cascade of intracellular reactions from occurring. So insulin still binds to its receptor as it's supposed to, but now the glucose ports don't get into the cell membrane. And so this is when our cells have become insulin resistant. But what happens if we take this meal, or we take this day of eating, and we replace it with plant-based foods? Here we have whole grains, legumes, fruits and vegetables. We have more unsaturated fats, so things like avocados and tahini and seeds rather than saturated fat. Well, then we actually see that this intracellular lipid can be reversed, and the cells can become insulin sensitive once again. If we look at it more from a molecular viewpoint, and I'd like to just draw your attention to the area highlighted by the green box, what happens is when these fatty acids are taken up into the liver and the muscle cells, they cause inflammation within the cell. And the result of that is that we no longer get this phosphorylation of the insulin receptor substrate, and that prevents this whole cascade of reactions. And that's why the GLUT4 ports don't get inserted into the membranes. So that is peripheral insulin resistance. And now we're going to talk about how saturated fat also affects the beta cells in the pancreas. Because initially, when your cells become insulin resistant in the periphery, the muscle cells, the beta cells are functioning normally and they're releasing insulin normally. But then you have obesity, and sometimes some people have a genetic predisposition, but lifestyle factors are often a lot more important than just the genetics. And then you have the metabolic stress. You have prolonged exposure to these elevated blood glucose. You have prolonged exposure to elevated free fatty acids in the blood. There's chronic inflammation associated with obesity. And ultimately, all of that leads to beta cell dysfunction, where the beta cells are still intact, but they don't produce as much insulin. And ultimately, we can have beta cell death and apoptosis. So the effects of a diet high in saturated fat and excess calories really affect us in multiple places. We have the peripheral insulin resistance in the muscles, where cells aren't responding to the insulin. We have the pancreas producing less insulin as the beta cells become dysfunctional and as they die. And then interestingly, we also have an increase in hepatic gluconeogenesis. So what happens then is that due to these fatty acids in the liver cells, the liver no longer responds to negative feedback. So even though our blood glucose levels are elevated from the insulin resistance and the reduced insulin that our body is producing, our liver is still churning out more and more glucose because this gluconeogenesis cannot be turned off as effectively anymore. And all of that contributes to the elevated blood glucose that we see in diabetes. So can we really reverse this intracellular lipid? Well, there was a randomized control trial that put 122 individuals on a low-fat vegan diet, so less than 10% of the total daily calories coming from fat. And when it did, it came from unsaturated fat sources like nuts and seeds and avocados rather than saturated fat. They also had a vitamin B12 supplement and otherwise were asked to make no changes in their daily habits. And then there was, of course, a control group that made no dietary changes and had no changes in exercise. And after 16 weeks, these were the results. Visceral fat was measured with a DEXA scan, and we can see that in the intervention group, the visceral fat surrounding the liver was reduced, while in the control group, it increased. And then a subset of 44 patients had an MRS scan, so a magnetic resonance spectroscopy exam. And this looked at the intramyocellular lipid and the intrahepatocellular lipid, so the lipid in the muscle and the liver cells. And the hepatocellular lipid decreased in the intervention group by 34.4% after just 16 weeks, and the lipid in the muscle cells decreased by 10.4%. And other benefits in the intervention group included significant reductions in insulin resistance, LDL cholesterol, and body weight, as well as an increase in the thermic effect of food. So the thermic effect of food accounts for around 10% of our daily energy expenditure. And basically, when you start to eat more plant-based foods that are higher in fiber, your body actually expends more energy to digest these foods when compared to very processed foods or animal foods. So though it's just a very small amount, it does contribute to daily energy expenditure. But it doesn't take years to develop this insulin resistance. And just one high-fat meal actually can reduce insulin sensitivity. So there was a metabolic ward study that was done, and I do not envy these individuals at all. Metabolic ward studies are where people are kept in ward, and essentially everything about their environment is completely controlled, from the food they eat to how much they sleep. And these individuals were fed either a low-fat meal with 10 grams of fat or a high-fat meal of 60 grams of fat. And these meals were matched for carbohydrates and glycemic index. The only thing that changed was the fat content. And the high-fat meal contained a bit more cheese. So individuals either ate the low-fat meal and then the following day ate the high-fat meal, or they started with the high-fat meal and then ate the low-fat meal the next day, with all of the meals in between absolutely identical. And if we look at the results here, these show glucose levels and insulin levels. We can see that the high-fat group had a higher peak blood glucose and it remained elevated for longer, despite having the exact same amount of carbohydrates as the low-fat group. And when they ate the high-fat meal, they also required more insulin. And these individuals were fitted with a continuous glucose monitor, and these show the averages of the results that were recorded. So we know that obesity is a risk factor for type 2 diabetes, and often there are obviously genetic risk factors, and obesity is very multifactorial. It's not just about the food, but very often those who are obese tend to eat more calories. So are all calories equal? Is all food equal? Well, in another metabolic ward study, 38 overweight adults were fed the usual diet plus an excess of 1,000 calories. And these excess calories came from 3 different main food groups. So there was the saturated fat group, and most of their excess calories came from coconut oil, from butter, and from blue cheese. I don't know why they chose blue cheese over cheddar cheese, but that is what the researchers decided on. There was the unsaturated fat group, and they got most of their excess calories from pecan nuts and from olive oil. And then there was the carbohydrate group, which got most of their excess calories from orange juice, from sugar-sweetened beverages, and from candy. So these were really refined carbohydrates, lots of added sugars, and they wanted to see if all of these had the same result on the amount of fat in the liver, because we know that obesity leads to NAFLD, or non-alcoholic fatty liver disease, and that is also a risk factor for diabetes. At the end of 3 weeks, this is looking at the intrahepatic triglyceride, so the fat inside the liver. And we can see that all groups experienced an increase in the fat in their liver. And it makes sense. If they're eating 1,000 extra calories a day, that has to be stored somewhere. And often that gets stored in the liver. But we see that the saturated fat group had the greatest increase in fat in the liver. Saturated fat increased liver fat by around 55%. Refined sugars saw a 33% increase in the liver fat, and unsaturated fat increased liver fat by 15%. So how much you eat is important, but what you're eating and what is making up those calories is also just as important, if not more. Also, in the saturated fat group, their insulin resistance increased by 23% at the end of 3 weeks, while there were no reported differences in the other groups. So if we move on now to, you have a patient in front of you and they have diabetes, maybe they've had it for a few years. It's now too late to prevent it. We know prevention is better than cure, but oftentimes when we see patients, they have full-blown diabetes, they're often on multiple medications. So what can you do then? The CardioPrev study was quite a large study looking at heart disease, but a specific subset of the individuals that were included in this were 177 with newly diagnosed type 2 diabetes who had not yet started on treatment. And these individuals preferred lifestyle changes to starting to take medication. So in the larger CardioPrev study, everyone was randomized to either consume the Mediterranean diet, which is mostly a plant-forward diet. It includes a lot of whole foods, but it also includes olive oil, some low-fat dairy, and some fish, or to consume a low-fat diet. Now, this low-fat diet wasn't a true low-fat diet, because generally in nutrition research, when we speak about a low-fat diet, we mean less than 10% of calories coming from fat. So that was part of the larger CardioPrev study, but then this subset that looked at diabetes took all of the individuals that completed the study and divided them into two groups: those who increased their plant protein intake and those who decreased their plant protein intake. And they were followed up for 5 years. And at the end of 5 years, those who increased their plant protein intake had a 71% higher chance of remission, meaning all of their blood sugar markers were normal, their HbA1c was normal, their fasting glucose was normal, and they no longer required any medication. But we also saw that this group had reduced their total unsaturated fat, reduced their animal protein, and they had increased their carbohydrates, increased their fiber intake, and increased vegetable, whole grain, nut, and legume consumption as well. And so we really need to start to move away from this notion that carbohydrates cause diabetes and carbohydrates are worsening diabetes, because we see that as people consume more whole food carbohydrates, they reduce their risk of developing diabetes. And also, if they are pre-diabetic or newly diagnosed with diabetes, they can prevent going on treatment for it. And then this is a landmark new study that was just released last month in June. And this was a 1-year interventional trial that was done in India. And they looked at over 2,500 individuals with type 2 diabetes. The mean age was 52, and the mean duration of diabetes was 10 years, which is a long time. At this point, most people are considered to have irreversible diabetes. Often it's very poorly controlled. And to be honest, a lot of people give up hope on treating these patients. So the intervention included a vegan diet, an exercise program, and stress management, and then medical management or medication when indicated. And at the end of the year, they found that 30% of these patients were able to achieve complete remission. And remission was highest in those who had never started medication, to almost 80%, followed by those who were only on oral medication. But nevertheless, there were some people who had had diabetes for 10 years, some people who were on insulin that were able to reverse their diabetes just by changing their diet, increasing exercise, and managing their stress better. This is another case series that was also just published last month, and this included 59 participants with type 2 diabetes. Here, the intervention was just diet, so it was a low-fat, whole-food, plant-predominant diet. You can see from the diagram that they did include some egg whites and some non-fat milk. But this diet was 75% carbohydrates, which is considered extremely high for someone with type 2 diabetes. And this predominantly came from whole foods, so vegetables, beans, whole grains, fruits, nuts, and seeds. And at the end of 6 months, 37% of these patients were again able to achieve complete remission, all normal glycemic targets and completely off all medication. And what's quite interesting about this study is that the mean age, though it's a small study, the mean age was 71 years old. So this also just goes to show that it's never too late to counsel your patients on lifestyle interventions, and that we shouldn't give up on people who are more elderly than the normal patients we see, because they can also still make lifestyle changes. And even if they aren't able to completely reverse their disease, some of them may be able to come off insulin or to reduce their dose significantly. So how fast do these changes occur? This is a 12-week randomized control trial that was actually done in people with type 1 diabetes, so insulin dependent, and 58 of them were randomized to either a vegan diet or to a control group. And the low-fat vegan group increased their carbohydrate intake by 118 grams per day, which is a lot of carbs, mainly coming from whole foods again. And at the same time, their daily insulin requirements dropped by 12.1 units per day. And altogether, their carbohydrate to insulin ratio reduced by a factor of 6.2. Whereas if we look at the control group, the carbohydrates decreased slightly, but there were no significant changes in their insulin requirements or in their carbohydrate to insulin ratio. So it just goes aren't necessarily the enemy here, but it's rather the type of carbohydrates that you eat. Even more significantly, 15 people, again, this was published in July, the 5th of July. So this is all very new research, very exciting. It's been a very busy 2 months for diabetes research publications, but we're very excited to have all of these new papers. And 15 participants with type 2 diabetes were enrolled in a crossover trial. And this aimed to assess acute changes in insulin requirements over a couple of days. So all of these individuals were fitted with continuous glucose monitors. And although researchers had access to this, the participants were asked to just continue to measure their blood glucose at home as per normal, and to adjust their insulin requirements accordingly. So after being fitted with the CGM, they followed their usual diet for 7 days, the DASH diet for 7 days. Now, the DASH diet is the dietary approach to stop hypertension. Again, it's a very plant-predominant diet, lots of whole foods, but it does include some eggs, some low-fat dairy, and some poultry. Then for 7 days, they followed a low-fat, whole-food, plant-based diet. And then for the last 7 days, they followed the DASH diet again. And if we look at the dietary composition of these diets, we see that the whole-food, plant-based diet, again, had the most carbohydrates, as well as the least amount of protein and fat. And the DASH diet was somewhere in between the baseline and whole-food, plant-based diets. These are their insulin measurements or their insulin requirements. So we can see that after just 7 days on the DASH diet, how their insulin requirements dropped significantly. And then for between days 14 to 21 on the whole food plant-based diet, again, despite eating more carbohydrates than before, their insulin requirements were even lower. So we can see here that the daily insulin dose or daily insulin requirement was lower with the DASH and the whole food plant-based diets. We see that the whole food plant-based diet was the only diet to statistically significantly improve the insulin sensitivity, reduced insulin resistance. And if we compare the whole food plant-based diet to the DASH diet, we see that the whole food plant-based diet had the best results. So how do plant-based diets improve diabetes? Well, first, as we've spoken about, they address the peripheral insulin resistance. They help to reverse the intracellular fat that has accumulated, and as a result, they improve insulin sensitivity. But we've also seen that when people with type 2 diabetes go on a plant-based diet, they are actually able to recover a certain amount of their beta cell function, and they're able to increase their insulin secretion. So what about very low calorie diets for diabetes? This is a trial of 30 participants with type 2 diabetes, and this was divided into 2 phases. The first phase was a liquid diet, and this lasted for 8 weeks. So they had 3 shakes per day and up to 240 grams of non-starchy vegetables. So things like spinach and peppers and broccoli, not potatoes or butternut or sweet potatoes. And their total daily energy intake was less than 700 calories. And all medication was stopped at baseline. After 8 weeks, they spent 1 to 2 weeks having a stepped food reintroduction. So every few days, one of the shakes would be replaced with solid food, but they remained on this isocaloric diet, so they were still getting less than 700 calories per day. And medication was introduced if necessary. So if we look at the results here, the white triangles represent the responders, or those who were able to go into remission. And they were, at baseline, they were characterized by a better first phase insulin secretion. So after you have a meal, that initial spike of insulin was better for them compared to the non-responders. And they also typically had a shorter duration of diabetes. So again, you're seeing that duration is quite an important factor when looking at diabetes remission. And they had significant improvements in fasting plasma glucose, in HbA1c, as well as weight. And at the end of the study, 43%, or 13 out of 30, had achieved normal glycemia. All of their HbA1c and fasting glucose, all of that was normal, and they were able to be off medication. But this trial only lasted around 8 or 9 months, 8.5 months. And so we don't really know what happens after they have stopped this trial and stopped this intervention. Do they go back to their baseline diets, or do they continue to eat at such low calories? And the next study was a bit longer, and this is the DIRECT study. So this is Diabetes Remission Clinical Trial. And this looked at 149 participants with type 2 diabetes, and they were more interested in people who had not had diabetes for such a long time, less than 6 years duration, and also individuals who are not on insulin. And similar to the last study, they were on a liquid diet. This was a liquid-only diet of around 830 calories per day. And then after 2 weeks, they started to reintroduce solid food again. And what they found was that the chance of remission, or the likelihood of remission, was directly related to the amount of weight lost. So those who lost more than 15 kilograms had an 86% chance of remission. 10 to 15 kilogram weight loss resulted in a 57% chance of remission, and it reduced as the weight loss decreased as well. After 1 year, 46% of these participants in the intervention group were able to achieve remission. And after 2 years, where they followed up with monthly appointments, the remission rate had dropped slightly to 35.5%. Now, the concerns with very low calorie diets, the first is the sustainability. This is 800 calories a day. That's not a lot of food. You could almost get that in a single meal if you tried. So these are extremely low food intakes, and someone could be able to keep it up for 1 year or 2 years, But what about for 5 years or for 10 years? We don't really know the long-term sustainability of consuming such low calories. And the other major concern with these very low calorie diets is if someone's only consuming 800 calories per day, are they actually meeting their micronutrient and macronutrient requirements? And there is a concern that consuming such few calories per day could put them at risk of various micronutrient and even macronutrient deficiencies. So very effective in the short term, but there are some long-term causes for concern that you should consider. And then moving on to the ketogenic diet. A study of 102 overweight and obese participants placed them on a very low carbohydrate diet. And this was 20 grams or less per day. That is basically 2 apples. So a lot of animal products, a lot of saturated fat, not a lot of whole foods, and definitely no ultra-processed foods. And at the end of 24 weeks, they found that blood glucose improved significantly, that glycated hemoglobin or HbA1c improved significantly. This study compared low-calorie diets to ketogenic diets as well, and they found that the ketogenic diet resulted in improved short-term outcomes. But what does this show us? This just shows us that the participants stopped eating carbohydrates, not reverse their disease. And I'm going to go into this in a little bit more detail in a second. But first, just a quick word on the carnivore diet. If you are not living under a rock, if you are anywhere on social media, the carnivore diet has completely blown up in popularity over the last few years. And so, especially if you're seeing patients in private healthcare who have access to often a lot more information, you will probably come across a few people who want to try the carnivore diet. And only one study has investigated the effect of the carnivore diet on diabetes. And they found that 74 had completely resolved their diabetes and 24 had improved their diabetes after going on a carnivore diet. Now, these results sound pretty remarkable, I won't lie. But what about the study methodology? What was the intervention? How was this all done? Well, it was a social media survey, and a lot of the proponents of a carnivore diet who have millions of followers went online, posted the survey and said, if anyone's had improvements in their health since following a carnivore diet, then please fill in the survey. So there was a massive population bias to start off with. But the second major concern was that these results were not validated through blood tests or physician reports or medical examinations. And so people could really say whatever they wanted to. And so while these results do sound remarkable, this social media survey really shouldn't be considered science. It shouldn't have been published. And it certainly shouldn't be considered as evidence for the carnivore diet. Now, when we're thinking about ketogenic diets, low-carb diets, carnivore diets, we need to remember that type 2 diabetes is essentially a problem of your body not being able to handle carbohydrates due to this insulin resistance. Our body doesn't know how to cope with elevated blood glucose because the insulin doesn't work. And so not eating carbohydrates is not the same thing as reversing the problem, because now you are just reducing the cause of the symptoms, if I can say it like that. You're taking in less glucose, you've got less glucose in your blood, and so less glucose needs to be absorbed. Obviously, your fasting insulin will go down, your HbA1c will be reduced, but the underlying insulin resistance in the muscle and liver cells is not being addressed. And so you can only really say that you've reversed diabetes when your body is able to regulate the response to eating carbohydrates and you're no longer insulin resistant at the core. So, as I said, if people are eating keto diets or these diets that are very high in saturated fat, you can see that there are fewer glucose molecules here on the screen than in the previous example that I showed of this diagram. But ultimately, the cells are still insulin resistant and this glucose cannot be taken up. Something that is very anecdotal, so don't quote me on this. I haven't seen it in literature, but what I've heard from a few patients who have been on these low carbohydrate diets for a prolonged period of time is that once they've been on it for a few years, their fasting blood glucose early in the morning starts to rise, despite them not eating any more carbohydrates. And the thought process behind that is that their bodies have become, or their cells have become so insulin resistant that even the minimal amounts of glucose that's produced by the liver overnight, their body cannot even handle such a small amount of glucose. So if we go back to the diagnostic criteria here, when we're thinking about low carbohydrate diets, if someone claims that a diet reverses diabetes, we really have to make sure that they do an oral glucose tolerance test. Because we know with dietary interventions, if someone's eating a lot of carbs and their blood sugars are maintained, they're off medication, that's great. But if someone is just not eating carbohydrates, we really have to do an oral glucose tolerance test to look at their underlying insulin resistance. And if you look at studies done on the ketogenic diet or the low carbohydrate diet, these studies, I have not found one that has reported on an oral glucose tolerance test. So just something to bear in mind when you're reading this nutrition research. And then the other thing to consider is short-term benefits versus long-term risk. If we look at a whole food plant-based diet, a low-fat diet, it both addresses diabetes and the underlying insulin resistance, but at the same time, it also improves and reduces the risk of other diabetes-related complications. Plant-based diets, we've seen, have been able to reverse diabetic neuropathy. People lose all of their pain associated with that and their numbness associated with that when they start a plant-based diet. We know that plant-based diets are protective against developing heart disease. And if someone does have cardiovascular disease, it reduces the risk of adverse cardiac events like MIs. It reduces cardiovascular associated mortality. And it also treats the other risk factors. It treats hypertension. And so with a plant-based, plant-predominant diet, whatever you want to call it, it's really addressing diabetes, but then also all of the other risk factors. Whereas if we consider low carbohydrate diet, particularly those that are heavy on the animal products, they show sometimes fantastic short-term results, great weight loss, great improvements in blood glucose, but we have to weigh up the long-term risks associated with these diets. And often they exclude many health-promoting foods like whole grains and fruits and vegetables and legumes that have all been shown to protect against heart disease and cancer. At the same time, it doesn't treat the underlying cause. And it also includes many animal products like red meat that have been shown to increase the risk of heart disease and stroke and cancer, breast cancer, prostate cancer, colorectal cancer, pancreatic cancer, as well as dementia, premature death, and all-cause mortality. And so if we're thinking about these low carbohydrate diets, to me, it really doesn't seem like the short-term benefits are worth the long-term risks, unless someone potentially just wants to do it for a couple of weeks and then transition to a more whole-fat plant-based diet. But I would recommend just going for the whole food plant-based diet initially. If we look at the European recommendations for the dietary management of diabetes, they have actually warned against very low carbohydrate diets due to safety recommendations. There's a concern of the increased LDL cholesterol and increased risk of developing hypoglycemias and ketoacidosis. There's also the risk of vitamin and mineral deficiencies. Now, if someone's following a fully plant-based diet, they should definitely be supplementing with at least B12. But if someone's following a low carbohydrate diet, they are probably not getting enough fiber if they're not eating plants. And that's very important to regulate blood sugar and prevent colon cancer. And then also just the overall long-term safety concern. So if we look at the main factors that determine diabetes remission, the first is clearly duration of diabetes. If someone has had diabetes for less than a year or has not yet been started on medication, they've been newly diagnosed, they have a much greater chance of going into remission compared to someone who's had it for 10 years. But as we see, that doesn't mean that we should just completely ignore those who've had diabetes for a long time, and every patient should be given the option to make lifestyle changes. The diet intervention initiated. So we've seen that diets that are centered around whole foods are very beneficial and increase the chance of remission. Low-calorie diets, ketogenic diets improve glycemic control with the long-term risks we've discussed. The amount of weight seems to be directly correlated with the chance of remission. So if you have someone with type 2 diabetes who is overweight or obese, one of the primary goals should be to lose weight, and the intensity of the lifestyle changes, of course. So if someone's eating an extra apple a day versus completely changing their diet, they'll obviously have different results. But importantly, it's never too late to counsel your patient on lifestyle changes. As we saw in the diabetes remission case series, the average age of that population was 71 years old, and some of them were still able to achieve remission. So don't disregard your elderly patients. So we all know how to prescribe diabetes medication, but since diabetes remission and deprescribing diabetes medication is a relatively new topic, there are no standard guidelines that we can follow, but nevertheless, every patient should be approached as an individual. And so here are a few considerations. The first is the side effects. The most dangerous side effect of these diabetic drugs is obviously hyperglycemia. And so you should probably consider stopping sulfonylurias like glimepiride and insulin first. But also if a patient has had some unwanted side effect from another drug, they may prefer to stop that first. Patient preference is such an important consideration. With lifestyle medicine, we are all about motivational interviewing. We want to equip patients with the knowledge so that they have the autonomy to take control of their health. And so this shouldn't be you deprescribing and telling your patients what to do, but it should be a conversation with patients about what their preference is. And more often than not, they're going to want to stop the insulin first. And then affordability. Often with public healthcare, a lot of our patients get their medication for free, but for anyone who works in public or has been through community service, you know that we are often out of stock of many medications. So some patients may have to pay for this out of pocket. Also in private, some medical aids don't cover chronic medication. So again, patients may be paying out of pocket. And just an example is that a 10 ml vial of Actrophane is around 500 Rand in South Africa versus a pack of metformin tablets, which is around 50 Rand. So if a patient is paying out of pocket, then it's also important to consider stopping the most expensive first. And again, the intensity of the lifestyle intervention. The more drastic the intervention, the more willing the patient is to change, the faster medication should be reduced. As we've seen, insulin sensitivity can improve in just a couple of days. And so their insulin requirements might drop very quickly if they're implementing a drastic intervention. Pre-intervention glucose control. So if someone is very well controlled, you'll probably have to deprescribe medication a lot faster. If someone is coming with blood glucose of 10 or 12 to an appointment, they can start to implement the lifestyle changes. And then as their glucose control improves, you can start to dial back their medication. Accessibility is another huge factor in South Africa. When studies have been done on physicians deprescribing overseas in first world countries, in private healthcare, they often do phone consults over the first couple of days. The first in-person appointment is at least 2 weeks, if not sooner, because when people change their lifestyle, these insulin requirements can drop quite dramatically. And so there is always that risk of hyperglycemia. So some people feel confident or comfortable doing phone consults at first and then appointments. If we're in the public healthcare system, often patients can't come more than once a month. And so with patients where there's limited accessibility to follow up, you might want to introduce lifestyle interventions more slowly and deprescribe medication a lot more slowly. Resources is also a big one. So if someone has a continuous glucose monitor at home or glucometer and they're able to check their blood sugars at home, then they can make more dramatic lifestyle changes. But again, if someone doesn't have access to any of these, often the clinics or the hospitals we work at run out of glucometers, then you don't want to suddenly go from insulin 3 times a day to stopping it completely, because then they run the risk of developing a hyperglycemia. So resources is also important to consider. Literacy level or cognitive impairment. So often elderly patients, some of our population that we have now didn't complete high school, so they may have a lower literacy level. Some of them have dementia or cognitive decline if they're elderly, or mental health problems. And so while some people with a high literacy level and high cognition can adjust their insulin at home, those who don't have that may need to have very strict instructions. And again, you may need to implement lifestyle changes more slowly and deprescribe more slowly. And then social support is another big one. Like I've mentioned, hyperglycemia is a risk when people suddenly start exercising and eating better. And so if someone lives alone, you want to implement these changes in a stepwise fashion. Whereas if someone's has a lot of social support at home, you can implement these lifestyle changes and deprescribe a lot faster. And again, every single patient with diabetes that you see should be counseled on the symptoms and the management of hyperglycemia. So just to end off, I think it's really important that as all of this new research is coming to light, we really need to start to reframe the way we think about diabetes. In medical school, I'm sure a lot of us were taught that diabetes is irreversible. It is essentially a death sentence in a way. Patients get worse and develop complications, and that's just sort of the end of it. But as this research is coming out now, we can see that diabetes really can be reversed. And the American College of Lifestyle Medicine has said in their position statement that remission should be our clinical goal with type 2 diabetes. It's no longer just about controlling blood sugars. It's no longer about preventing amputations, but our primary goal should be remission through a properly dosed intensive lifestyle. So thank you everyone for joining us, and I hope that that was informative and that you learned from that. And if you have any questions, please feel free to pop them in the chat.
Thank you so much, Roxy. That was incredible, really. There was so much knowledge. I think I took notes and everything, but definitely going to have to rewatch that presentation. So much going on and such brilliant information. If you want to check the chat, Jaden has asked us some really excellent questions, and maybe you could answer him almost all at once, because I think there's a lot of really smart emphasis going on here regarding the current teaching around diabetes, because until I personally did Lifestyle Medicine and until many of you have listened to this talk, a lot of this was not the message we've been taught.
Great, let me go through them. So the first question is, why is the emphasis regarding diabetic control or prevention targeted more towards excessive sugar intake versus excessive saturated fat intake? And I think that largely just goes back to the old school of thinking. You know, traditionally what we've been taught and what a lot of people have believed is that diets very high in ultra-processed foods that often have a lot of added sugars are the cause of diabetes. Diets high in carbohydrates lead to obesity, which leads to diabetes. That's sort of the traditional school of thinking. But as you can see, more and more research is coming out that saturated fat actually plays a larger role in that rather than excessive sugar intake. But excessive sugar intake, excessive calories also do play an important role in developing obesity, NAFLD. So that is not to be disregarded as well. But especially as people start to lose weight and are more of a normal BMI, we see that saturated fat plays even more of an important role. When you talk about whole food carbs, what are you referring to? So whole food carbohydrates are your whole grains, so brown rice and quinoa, rather than refined grains like your white bread and your white pastas. Whole food carbs include fruits and vegetables and legumes. So anything that comes from a plant food that you can essentially pick and consume or cook and consume. And that is compared to refined carbohydrates, things like our ultra-processed foods, our white breads, our pastas, our pizzas, etc. Is there a diabetic medication that addresses the issue of excessive intracellular lipid, which is the main driver of insulin resistance? As far as I have seen, there isn't any medication that addresses that. And it seems that a predominantly weight loss and then also the dietary composition seem to be the main factors at reducing intracellular lipid. There are weight loss medications, like I'm sure you've seen Ozempic, which is both for diabetes and has weight loss as a side effect. Through weight loss, that can reduce intracellular lipid, but there aren't any diabetic medications that specifically target the intracellular lipid. I hope that answers your questions. I'm just trying to see if there are any more here. Have any tools that can be used to counsel patients and continue motivation through their intensive lifestyle medications? I think that's interventions, as many of our patients become despondent with limited results and changes seen in the beginning. That's a great question, and I should probably include a slide in that next time I talk about it. At the Physicians Committee, pcrm.org, there are a lot of free resources that can be downloaded that you can hand to patients. I know the Plant-Based Health Professionals UK, they have a website with a lot of great downloadable resources as well. A lot of these include fact sheets. There's the 21-day Kickstart application from PCRM where you can download that for free, and it gives you 21 days of recipes, low-fat plant-based recipes. So if someone has a smartphone, they can download that. I know the American College of Lifestyle Medicine also has some great free resources, and over the next year or so, Salma will be building our own free resources that you can also give to your patients. So definitely look at those websites. Can exercise be sort of substitute for an ideal plant-based diet? Many people in the States, oh, sorry, I can't see that bit, regard controlling blood sugars being almost exclusively necessary over a whole food plant-based diet. So exercise is very important. So if I could rank it in order, if we're looking at diabetes or glycemic control, I would say weight loss should be the most important. Second to that, a diet that is low in saturated fat and high in whole food plant-based carbohydrates, high in fiber would be the second most important. And then exercise would come in at number 3. It is definitely important, but we do see more results just with diet interventions rather than exercise interventions. I think that is all of the questions that we have for the moment.
Yeah. So, and we're also out of time, but thank you everyone for attending as well as for being a part of this. I think we all learned so much and we all learned together, and your questions were excellent. I just want to add a date to something small. Is last month we were honored to have a presentation on the coach approach and motivational interviewing. You might want to, I'm not sure if you were able to watch that live or you want to access the recording. It was with Dr. Lydia Altini, and I think that also gives some really great ways to use the incredible resources to help our patients and really keep them motivated. And for anyone who watches Ted Lasso, be the Ted Lasso keeping them going. But really, thank you everyone for joining. Roxy, thank you so much. As always, learned unbelievable amounts from this presentation. For anyone interested, we are already very excited for Women's Month next month, and we will be having a really excellent webinar with Dr. David Glass around women's health and lifestyle medicine. And these are topics that are tough that women struggle with: endometriosis, infertility, breast cancer. So definitely I'd urge you to all, please keep an eye out and attend and learn, because the more we can help ourselves and our patients, really, the better we can create a healthy society together. So have a great evening, and thank you again so much for attending.
Thanks for joining, everyone.
Thank you. Well done, Salma.
Thank you, everyone. Great to be